Okay, go ahead.
Thank you. Hi, my name is Yvonne Chow, and I'm the MBQIP coordinator with the Federal Office of Rural Health Policy. Today's webinar will be going over the updated MBQIP data reports. We're hopefully going to be able to get you the reports in the next week or so. Today on the call, we also have Mary Philman from Intelligent, who's been working with us on these reports, as well as Arkita to help answer any questions that I am not able to as well as Intelligent. So we can begin. Okay, so the overview today is we'll go over what each state file will include. We'll go over every change to the report, and I've included a lot of screenshots just to give you visually how you will see the report change. Some changes are 2 general format changes, 3 new columns, 4 new footnotes, and addition of OP3A data, as well as some tips and resources for you to help you understand your data more. Okay, the first one is what each state file will include. Per usual, you will receive individual call data reports for those that have signed an MOU, and these will be in PDF forms. There will also be a state roll-up of all call submitted data that have signed an MOU. And so those reports you've already gotten before with the additions to the changes. Next is the raw data. You've previously received the raw data, but what this raw data will include is the MBQIP core measures, as well as the integration of the population and sampling data will be included in these reports, and that will be in Excel form. And the next slides will show what that looks like. The non-submission list is also new. This will include a list of every call that has not submitted any data at all on MBQIP core measures. And again, this will be in Excel form, and the next few slides will show that as well. So the first one here is your raw data, and if you've never looked at it, this is what it generally looks like. What you will notice is in the red boxes, that is the population and sampling data. So what it does is it cross-references the population and sampling data for each measure set. And so each measure set is listed below: the immunization, AMI cardiac care, ED, as well as pain management. And so for all these slides in general, they're only for the patient safety and outpatient measures, since those are the reports that you'll be getting soon. You can see the first one is IMM2 total pop, and so that is the population and sampling data entered at the beginning of every quarter into quality nets. And so the next few slides will go over the significance of adding in this data. So the non-submission list, this is fairly new to everyone. What it will include is a non-submission list for the patient and safety and outpatient measures, all listed below, one for HCAHPS as well as EDTC. So what counts as submission? What counts as submitting data is if there is cases submitted into the data warehouse, if cases were submitted but ultimately rejected because it did not meet the measure criteria. So now if you notice, it means that if your call tries to submit data and it ended up being excluded, we're actually counting that as submission. Another one that counts as submission is if you entered a 0 into the population and sampling data. And what that means is there's no one in your population or your patients that met the AMI criteria or, you know, the immunization measure population. What a non-submitter means, which is notated by an N, it means that no data was submitted at all. It means that the call did not submit any data for population and sampling. It did not submit any eligible cases to QualityNet for that quarter, as well as it may have submitted population and sampling data that was above 0, for example 3, but ultimately when it came down to submitting on the actual cases, they didn't actually submit any case, they didn't submit anything. And so I'll go over what that means in the next few slides as well. So this is what the Excel sheet looks like. As you can see, for patient safety and outpatient measures, it lists all of the MBQIP core measures, and there's an N notated next to each critical access hospital that did not submit any data at all. And so, as you can see, these are blinded data. Next, we'll go over the general format. There were 2 general format changes made. The first one is the title of the reports. They will align with the MBQIP domains. So the patient safety and outpatient measures, that's one domain, or 2 domains integrated into one. There's patient engagement, which is HCAHPS, and care transitions, which is EDTC. What we've done is we've also combined the reports for inpatient and outpatient measures in order to reduce the number of reports you receive per quarter. So now, rather than 4 PDF files for each domain, you'll only receive 3. As you can see, listed below are the titles of the reports. So the first one will be MBQIP Patient Safety and Outpatient Quality Report, Improving Care Through Patient Safety and Outpatient Measures. Next is Patient Engagement, Improving Care Through HCAHPS Survey. And the last one is MBQIP Care Transitions, Improving Care Through Emergency Department Transfer Communication. The second change I mentioned is the integration of inpatient and outpatient measures. As you will see on these reports that you will get for fourth quarter 15, is that there will be 2 pages on the PDF files. So make sure to look for both because they include IMM2 as well as all of the other outpatient measures. So for the new columns, there were changes to 2 columns. You only received 1 column in the previous reports. So now what we've done is we've made it more descriptive for the average time and overall rate. The second column is the number of calls with MBQIP MOUs submitting data, as well as the 90th percentile. So these new columns will be added to the state and national data for the current quarter, as you can see here. So it may look like a lot of information on it, but it's because everything kind of just had to be squeezed into the page limit or the page format. So the new column is not really new because you actually used to get the average state and average national. What we've done is we've made it more descriptive because we understand that there's rates and times. So now the report will say average time / overall rates. The next column is now you will be able to know how many calls with MBQIP MOUs are submitting data. So for example, for OP1, we know that 13 calls in that state reported for OP1. Down at OP18B, we can see that 49 critical access hospitals submitted data for that quarter. And so by submitting data, that's our definition by what submission is understood as I stated previously with the non-submission list. Next is the new columns for the 90th percentile. So Penny, you had a question. The measure is median time, but the column says average time. And so this kind of just encompasses everything. So it does include the median time as well. It's supposed to mean the same. But on the raw data, it will say median. Okay, so for 90th percentile, we see here it's a double asterisk. What you'll do is you'll just go down to footnotes at the bottom, and it will give you the definition of 90th percentile. The 90th percentile is the level of performance needed to be in the top 10% of calls for a given measure. So we can see here for OP1, it was 19 minutes compared to the average, which was 25 minutes. Um, for Susan, I will answer your question at the end. For the footnotes, we have a new footnotes. They were updated. The first one is just where you should direct your questions. What we've done is we've just updated the hyperlink so that it leads you to an active page. The next one is a single asterisk where it's reporting is not required for this quarter. The next is the 90th percentile, which I already went over, as well as the last three, which will take the bulk of this webinar. First is NA. NA means not available. It means that the provider did not submit any data to the QualityNet warehouse. 0 means the provider had no cases to submit for the measured population. And DE means data was excluded. It means that data was submitted but excluded because it didn't meet the measure criteria. So the first footnote I'm going to go over is the reporting not required for this quarter. As you can see, this most applies to OP22, patients left without being seen, as well as OP27, since those are both measures that are submitted on a yearly basis. And so for the other three quarters, first quarter, second quarter, and third quarter for OP22, you'll see a single asterisk, means you don't need a report for that quarter. For the footnote for NA, NA means not available. There was no available data in the warehouse. So it means that the provider did not submit any data for population and sampling, as well as didn't abstract or upload any data or cases into QualityNet. And so the next few slides will go over what this means when you look at the raw data. So for this one, you see the report up there, data report, and then what you would do is you would pull up your raw data file, and first you would go down to the provider, you would go across the row to the column that says AMI total, and so for the AMI total population, you can see here that nothing was submitted by the provider. And so then you go over to the actual columns for OP1 and OP2, and you can see that there's nothing. There's blanks in it. And so when there's blanks in both the total population column as well as OP1 and OP2, then that means that the provider did not submit anything to the warehouse at all. So that's why there's an NA on the report. When you go down to the non-submission list, because they didn't submit anything at all, there's an N next to OP1 and OP2. Another example of NA that we have encountered is this one. So this one is the provider. We can see that OP1 through 5, all of it says NA. And so what we're going to do is we're going to look at the raw data to see what this means. So you can see here, it's the same data report that says NA. What we do is we open up the raw data file, we go down to the provider, we go across the row to AMI total pop. And so for this example, we can see that the provider submitted a total population of 3 that they thought met the criteria for AMI. So they submitted this at the beginning of the quarter through QualityNet. But when it came time to actually submitting data, this provider did not submit any data at all, which is why you see blanks across OP1 through 5. And so what that tells us is if you had cases to submit, but you actually didn't do anything, that's considered a non-submitter. That's why you see when you pull up your non-submission list, OP1 through 5 is an N. So that's another case where NA would be applied. Next is 0. And so 0 means the provider had no cases to submit for the measured population. And so for this example, we're going to look at OP21 specifically. So what we do to verify that it is 0, we open up the raw data report. And we can see here that when we open up the raw data, we go down to that provider and we go across to the PM total population, which is the pain management measure set. We can see that the provider entered a 0 in. That means no patients met that criteria. So they went in and entered a 0 for the population, and when it came time to submitting data, they didn't need to submit anything because they reported a 0. So that's why you see a 0 in OP21. So now when you pull up the non-submission list, when you go down to OP21, there's a blank. And a blank means they actually submitted. So there's no N next to it. So what this means is that 0 equals submitting data, according to MBQIP. Another example of 0 where population sampling makes a difference is in this case. For this provider, we can see that OP1 through 5 is 0s. So what this means is there is no one in the population that met this criteria for that quarter. So we go down to the raw data. And so we can see from the report here, when you open up the raw data file, you go down to the provider again. You go across to the column that says AMI total pop. And you can see that for this provider, they had no one in their population that met the measure. And so they entered a 0 in at the beginning of the quarter. And so that tells us that because they had no one that met the criteria, they didn't need to submit anything for that quarter. So as you can see here on the non-submission list, when you pull it up, for OP1 through 5, it's counted as submitting data because they entered 0. So again, this means that 0 equals submitting data, according to MBQIP. So the last footnote is DE, data excluded. And so data excluded means the data was submitted but excluded because it didn't meet the measure criteria. So what it looks like is this. So that's the same report. We're going to specifically look at OP1 for the DE. And we can see in the raw data that this provider entered in an AMI total population of 3. But when they went to submit data for that quarter, you can see that there's a 0. And so now the 0 should not be confused when there's a total population of 0. Because if there's a total population of 0, they shouldn't be submitting data. But because they told us that, or they told the warehouse that there was a total population of 3, they tried to submit cases. But what ultimately happened is those cases that they thought met the measure criteria didn't actually meet the criteria. That means they were actually rejected from the data warehouse, which is why you see a 0 there. And so when you pull up the non-submission list, you will see that for OP1, it actually is a blank, because this means that they were giving you credit for actually trying to submit data. So it means that DE equals submitting data according to MBQIP. And so every time you see a DE on the report, it's a great learning opportunity for the call. It means that they attempted to submit cases, but there's a learning opportunity to really look at the specification manuals again and really understand why this patient didn't meet the criteria. And if you wanted to learn more about why that patient didn't meet the criteria, definitely refer back to the specifications manual, as well as encourage the critical access hospital to pull up the report on QualityNet. QualityNet will give you more detail into why the patient was ultimately rejected. So for Scott Daniels' questions, what would it look like if the patients drop out, they had a population but none qualified? That's what the DE would account for. So for OP3B, we know that there was a lot of confusion around it because there's OP3A, B, and C. So what we've done to help with this is we've actually added in OP3A. OP3A. And so for this report, we're specifically looking at OP3B, and we see that there's a DE for it. And so when we pull up the raw data, we can see that there was data submitted for OP3A. And so because there was data for OP3A, and we know that it was excluded when it went to the OP3B, as denoted by the 0, we can see that the code does is it cross-references the A first. So if there's data for A, but ultimately none met the B criteria, it still counts. Because as you see in the non-submission list, it's a blank. It means that we're counting it as submitting data. So hopefully this will help with understanding why there's a DE or an NA or a 0. And for everyone, for the fourth quarter 15, when you get the reports, those will actually include first quarter, second quarter, and third quarter raw data with the integration of population and sampling. And so you can do a trend analysis of this, and you can see it in action. So this is a chart of the scenarios listed. I didn't go over every scenario, but this is a chart of all of the scenarios possible. And so I really encourage you to look over this. If the report isn't accurate, please let us know. Please reach out to your project officer, and please reach out to TASK. They'll be able to help answer your questions. And if there really is something wrong with the data, where the raw data isn't lining up with the PDF file, definitely reach out to them and we can fix it. So some tips for you guys. We really encourage you to encourage your cause to submit population and sampling data, because this is a great addition to our reports. The fact that we're allowing or counting a 0 as submitting data, because we're accounting for the fact that a lot of cause have low volumes. And so as you can see here, over the past year, we have seen more and more hospitals report on population and sampling data. We see it in IMM, AMI, ED, and pain management. And so this is one of the reasons why it makes a difference. So if we didn't make any changes to these reports at all, this is only for the outpatient. This would be the number of non-submitters for the outpatient measures. So in third quarter 15, there are around 550, and for fourth quarter 15, there were 400 non-submitters. So if we add in the fact that we've made all these changes to the MBQIP reports, we can see that there's a decrease in the number of non-submitters. And so for third quarter 15, more than half of the reasons why they were counted as submitters was because of the integration of population and sampling data. For fourth quarter 15, it's because we saw the addition of all of the OP measures, such as OP emergency department, OP22, patients left without being seen. We see it with the addition of the population and sampling data. And so we hope to see a decrease in the number of non-submitters now that we've allowed, we've integrated population and sampling into the reports. Now, tip number 2 is to remember to submit your cases. The deadline for entering in population and sampling is different from submitting data to the quality net. And so when I go over the resources, I'll go more into depth about that. So the reason I bring this up as a tip is because if you submit a number greater than 0 for the measured population, but you forget or there was an error in when you submitted the data that you didn't submit any cases, that's counted as a non-submitter. And so that was the example slides 19 and 20. And so I really encourage you to encourage your hospitals, if they're entering population and sampling data, please remember to submit your cases when it comes time to the deadline. Stephanie, we are about to answer your question regarding the deadlines for population and sampling. The third tip is to understand your data. I know that a lot of you probably shy away from the Excel sheet and raw data, but we really encourage you to look at it. It's really not as difficult as you may think, and it's actually really fun to go over, at least from my point of view. And sometimes it can be really informative of the DEs. If you don't want to look at your raw data, look at your PDF files. The slides I went over that explained how you can verify an NA and a DE was with the raw data, but the PDF files are accurate. And again, if there are any errors or you have any questions about the reports, definitely feel free to reach out to TASC as well as your project officer. So what you will expect in the next quarter's report, as I said, when you get your fourth quarter 15 reports, those will include everything I listed before, as well as first quarter, second quarter, and third quarter raw data files. For first quarter 16 reports, those will include the OP27 data. So the data you entered for that will be there in the patient and safety and outpatient reports. For the HCAPS, the same thing. You will also get a non-submission list for that, and you will also get the raw data for that. Second quarter 16, you should be receiving those reports shortly as well, including a non-submission list. So the resources. As you all know, using MBQIP data is a resource available on TASC. And so what Arquita is going to do is they're going to update it to include all of the changes I just discussed on the reports. And so when that's available, we'll definitely be messaging it out to all of the FLEX coordinators as well as those on the MBQIP listservs. The MBQIP reporting guide, it demonstrates how you can submit or enter in population and sampling data. So if you haven't taken a look at that, I definitely encourage you to look at the reporting guide. For the MBQIP data submission deadline, what we are doing is we're going to update it to include the population and sampling submission deadlines. For the monthly reporting reminders, these already have integrated population and sampling deadlines. So if you've been forwarding those to your calls, they've already been getting notices about the population and sampling deadlines. Furthermore, for the call quality improvement implementation guide and toolkit, definitely take a look at that. Now that we have a more complete data set for raw data, I encourage you to use Excel templates as well in there. So I just want to acknowledge Telegen, the Center, and Stratus Health. Over the past few months, we've been going back and forth on a weekly basis about making sure these reports are including the population and sampling data, making sure that they're accurate, and we're doing a final rerun of it. And it's definitely taken a lot of cross-checking with Stratus Health, with Arquita, with Telegen, with the folks in the office. So I really encourage you to give them a big kudos because without them, these reports wouldn't have been as great as they are right now. And as usual, you know my contact information. There's my email and my phone. And so now we're going to open it up to the Q&A. I think I'll stop with Penny's question about the median and average being different. Yes, it should be medians. And so, unfortunately, we can only fit so many words in a column to make sure it fits in the same PDF file, and so it does mean median. Scott Daniels, I think I answered your question about the DE. Stephanie, I think I also answered your question about the deadline submission chart. Jen, can you explain why the population and sampling data has a different submission timeframe than the actual data? My best answer is it's a CMS requirement. Arquita or Mary?
Just a reminder, it's star 2 to unmute phone lines to ask questions or answer questions.
Hi, this is Robin from Arquita. The
About the question about the population sampling having a different submission date, Yvonne was right. It is a CMS requirement. As best as I can explain it, it really pertains more to the PPS hospitals, and because of their payment requirements, and they have to submit a certain number, or they're going to, it's the number that they say that they have in their population. That's what CMS looks at to determine whether they've submitted the right number of cases in the warehouse. So if the hospital says that they had 10 cases in the population, CMS looks to make sure they better at least have 10 cases in the warehouse. And if they don't, then they could be losing some of their annual payment updates. But that's what they use to determine that. The reason that it's earlier, again, it's just because they look at that to determine whether they've got the right number of cases. That's as best of an explanation as we've ever gotten about that. Great. Are there any other questions?
Hi, Yvonne. It's Marcy. I have a question.
Yes.
Can you hear me? Okay. How often will we receive the non-submission list prior to each deadline?
So this non-submission list will actually be the same time as when you get the quarterly reports. So there won't be anything sent prior to a submission deadline.
Thank you.
But what we know is that for the outpatient, we know that CMS has started sending notifications to the QualityNet administrators who are registered with QualityNet about what they see in the warehouse currently when it almost comes down to the submission deadline. And so that might be an avenue for a cause to know that, hey, you need to submit data. Great. Any other questions?
Hi, it's Marcy again. I have another question.
Yep.
On the NOA call last week, you mentioned with the OP27, if the hospital had gotten access to NHSN, that would count for that measure. Will the reports reflect that information?
So for the first quarter 16, that won't be the number that are registered with NHSN. It will actually be the number of hospitals that actually submitted data for this past year. But we do have a list of the hospitals that have submitted data as of, I think, June. We'll be getting an updated list soon in a couple of months, so 6 months difference time. So hopefully from that we'll be able to share with the flex coordinators who has signed up and who has not.
Great, thank you.
Great, any other questions? There's one question on the line. Is there a way to know the denominator for the number of calls with MBQIP MOUs submitting data? That should just be the number of critical access hospitals with signed MOUs. We're almost at 100%, so that should be your denominator. If you have a call without an MOU, then you would just get the total of that. Stephanie, these reports showed national roll-up data. I see the state level, but I didn't catch if this still has national. That will be in a column section. So there will be the state and national columns. So here you can see that these 3 columns are for the states, and the next 3 that's cut off from the slide is the national. So you will see a roll-up. Susan, what state are you? Kansas. Yeah. So pretty much, yeah, if you have, I can double check for you, but the question from Jen is there an opportunity to get raw quarterly data for HCAHPS instead of the 4-quarter average? At this point, that is not possible because of the way HCAHPS is calculated. You can only get the 4-quarter roll-up. We are currently still working with CMS to see other ways we can monitor a cause progress. So until we get further information, no, we would not be able to get quarterly raw data. Any last questions?
I have a quick question. This is Stephanie from Idaho. Will there be a recording sort of similar to this for the CAHs to understand how to better read their new reports, or is that something that we just do on our individual TA? I realize their reporting piece is also going to change as far as the way that they look at it with the additional columns and that sort of thing. Will there be anything, or can we use this? What's your suggestion?
I think that you can definitely use this recorded webinar, and if they have additional questions, definitely reach out to us. I think we might consider if there would be a separate recorded webinar, but as of this time, we don't know. We don't have a final answer for that.
Okay, thank you.
For Pete's question, can you say again why the average and median are being used as the same measure? Artita, would you be able to answer that?
Just a reminder, it's *2 to unmute your phone line.
Hey, Robin, are you still on the line?
Yes, we're here. Sorry, we don't hear us.
Muted.
Yvonne, can you hear us here in Minnesota at Arcata now?
Yes.
Okay, thank you. We had too many mutes on our end here. To Pete's question about median or average, the original reason was fit. We can revisit it and have some offline conversation. It was fit with columns with state versus national, but can we regroup and send a note just to help with communication on that? It
is limited to footnotes and amount of space we can fit in the PDF. So we'll make sure that's clear for everybody to explain to your cause moving forward. Yvonne or Mary, I don't know if you have anything to add on that as well.
Yeah, this is Mary from Telegen, and the column header average time is actually an average median time because the data that's given to, that's calculated is a median, but then when you forward that data, as you see in your raw data, those are median times, but when you forward those median times to the report to calculate a state average, you cannot do a median on a median time. So we elected to display an average median time. So either it's an average median time or it's the overall rate. Does that help answer the question?
I see a yes on the chat. Is there another yes from Pete?
So for Bryna Cook's question, so the average time is a mean of the median times. No, it is not. Just as I said, it cannot be a median of the median times. It's the average time.
And this is Laura at Arquita. This is something we'll put in comments in the guide that we're going to be revamping with how to use these reports, just to make sure it's clear on your end when you're using this with cause. But it's a bit of a confusing concept when you get data that's already aggregated like this. You need raw data to calculate medians. Raw in the sense of patient level.
Great. One question from Michelle is, any chance we may be getting reports in a run chart format to help see progress over time? That's something we can consider, but at the moment, no.
Yvonne, this is Stephanie from Idaho. I have a quick question, and this may be just a personal issue, but I had funds set aside for benchmarking these new measures in August, and I pushed it back as far as I could, and I'm waiting for the data from these reports to be able to at least benchmark for the state, and if I don't get the contractor to do it by the end of August, then obviously you see they'll have unspent funds for Flex. Is there any way to even just get the raw data at this point, not the nice glossy PDFs? Would that be an option for people like myself that have sort of this obligation to the contractor by the end of August to be able to spend down my funds?
Yes, that is something we could probably do. Just send me an email, and I can follow up.
Okay, great. Thank you so much.
Yep. There's a question by Scott. So you're saying you don't have the raw data for the medians? Telegen or Akita?
Yeah, this is Telegen. So the raw data is at a patient level. So we cannot provide, that'd be a large file. And so what we provide for the reports, I calculate, I take the patient data and I roll it up to a hospital level data. So that's what you're seeing is a hospital level data. And so that's the median calculation for the hospital. So, so at this point, no, the overall raw data is not available for the MBQIP reports.
Correct. You would see the median for the state and national. Great. Any other questions? This is the time because we have Arkita and Intelligent on the phone.
To answer Scott's question, the average is the average of the median time.
You guys don't necessarily need to type it. You can just say it on the phone if you unmute your line.
It is, the time isn't a median time because we cannot do a median of a median time without all of the raw data. And currently that's not being produced for the reports. It's just a lot of data.
Penny, can you hear me?
Yep.
Great. So I hear what Scott's saying, and I'm hearing some contradictory response. So you, Intelligent, I understand, are not going to provide the patient-level data to us, and I'll get over that. But you have it, so you could produce a median for the state because you have that data. Is that correct?
Yeah, this is Intelligent. Yes, we do have the patient level data, and the way it is currently being calculated for other purposes, it's based at a hospital level calculation, and that's how it's currently being calculated.
Right. But theoretically, you could do an analysis to come up with a state median because you do have that data. But right now, I understand it's set up to calculate to the hospital level, but it could be set up to calculate to the state level.
I'd have to look at what is in the warehouse, because the warehouse is based at a hospital level. It doesn't tell me that this hospital is within this state, and that's where the difficulty comes in.